Lifestyle changes are important to health because they can help prevent or manage many chronic diseases and conditions, and can also improve overall well-being. Poor lifestyle choices, such as a sedentary lifestyle, unhealthy diet, tobacco use, and excessive alcohol consumption, can increase the risk of developing chronic diseases such as obesity, type 2 diabetes, heart disease, stroke, and certain types of cancer. Making positive lifestyle changes, such as engaging in regular physical activity, eating a healthy and balanced diet, getting enough sleep, managing stress, and avoiding tobacco and excessive alcohol consumption, can help to prevent or manage many of these chronic diseases and conditions. In addition, these lifestyle changes can also improve overall physical and mental well-being, increase energy levels, and promote longevity.